Yes, everybody is excited. They have graduated. We've had the parties. There's all this pomp and circumstance, but now what? Do they have the tools that they need to succeed? Yes, they have the scholarships and they're headed off to big name colleges and they're going to their dream schools and all these different things. But do they know what dose of medication they need to take if they get sick? Do they know the resources on campus to go to and the things that are available if they're sick or if they're having any kind of an issue? Well, if you are not aware of that and you really want to set your scholar up for success, keep watching because we are going to help you navigate all of that today. Welcome to Lessons Beyond the Stethoscope, where we provide practical health tips and tools that you can use in your everyday life. Because what we understand is that your life affects your health. I am Dr. Ashlie Booth. I am a board certified family medicine physician and I am your host on today. I'm also the owner of Healing Beyond the Stethoscope Primary Care, which is a membership based practice in Savannah, Georgia. And today I have a very special guest who is joining us because we are going to be discussing talks beyond high school, things that your teens and young adult women need to know, and things that you wish you did. So, joining is Dr. Loretta Duggan. She is a family medicine and adolescent medicine physician who is also the owner of a private medical practice called Her Health in Athens, Georgia. So, thank you so much for joining us today, Doc.
Yes, hi, Dr. Boo. Thank you so much for having me. Can't wait for our conversation.
Yes, so like I said, going off to college, everybody's excited, all of these things, and we feel like we have prepared these people to go to the next level, right? And as far as the educational side of things, we may have. But the thing that you and I both understand is that going to college is a transition, and it doesn't matter how well prepared you feel your scholar is, it is a transition and it's like a new environment, and how do I fit in here and what do I do, and the culture changes, like it just can be a lot and it can be overwhelming. So one of my first things I want to ask you is like, what are some of those important things that parents can do, and just simple tips that can help smooth this transition from high school to college, especially with their daughters? And it could be medication, whatever, but what are some of those things that you think are essential that they should discuss?
Yes, I'm so glad that we're having this conversation. And like you said, with college, it's a whole nother transition. Think of it like, okay, middle school, high school, here we are again going through yet another transition in the journey of life. And college, it will be different, but in some ways it won't be.
Mhm.
With that, learning our new peer groups, how is it that we're going to be able to fit in, learning where our classes are. Okay, the academic part of things, yes, for the most part, we're going to have that down. We'll have the support that we need for that. But what about now? It's time for your teenager, your young adult to start embracing that independence and going to the
Mhm.
doctor, making a doctor's appointment. Do they know where their insurance card is, how insurance works? How much will that copay be? Those are important things that they can start to embrace along with the academics. In addition, now when we're going to set up that doctor's appointment, that may be one of the last ones you go to with them for a time, um, are we letting them take that conversation and lead it? Can they express themselves and what they need, have an opinion about the treatment plan and things they may not be open to doing, and then starting to make those decisions themselves? So it's really about them starting to transition into adulthood, into that level of independence where you're still kind of, helping them a little bit along the way, but really the decision making now and understanding those consequences of their decisions is coming down to them. So I mentioned one example with going to the doctor, now them starting to take over in terms of leading that conversation. Another could be, you mentioned medications. help them to prepare like a health toolkit for them to have in their dorm, something they can have quickly that they can get to in case they have, not in case, when they have
Mhm.
things to come up like coughs and colds, when they have headaches, when they have issues with their periods, making sure their period supplies are intact. So whether it's the Tylenol, or it's going to be the Advil or the Aleve, the ibuprofen that they're going to use, whether it's Midol, if that worked better for them, making sure they have those things readily available. How about a thermometer? Do I even have a fever? No, I feel a little bit warm, but I don't know for sure. Having that thermometer with them, common cough and cold medicines like Robitussin, like cough drops, things that they can have right there with them. You can help them to prepare it, and then
Mhm.
also let them know, hey, this is something that you can keep stocked up and ready to go. So if you do need it, it can be available for you. And then if that doesn't work, hey, it's all good. You tried, you're still having symptoms and issues, then that's where you likely have like some type of student health center that you can go to if need be an urgent care, if it's like maybe over the weekend or after hours, or the emergency room if it really is a serious condition that we're concerned with. So, starting to lay that groundwork for them to embrace their independence more so that they can start to make these decisions for themselves in addition to embracing the academic aspect of things.
Oh, I love that so much. And there's so many pieces of it that was just amazing because the starting them with the independence, with going to the doctor and having the conversations now, as a physician, if I have a parent and a child to come, if the kid can talk or even express something to me, I say, parent, let them tell me, even if they're two. And they're like, but
Hmm.
you're not going to understand. I'm like, it's okay. Let me see what they can tell me.
Hmm.
And the kid loves it. They're like, yeah, and it hurts over here. And it when I do this, And so
Yes.
it's so simple. It's so basic, but they love being able to say this is what's happening. And I'm like, parent, you can always chime in later to fill in the details and let me
Hmm.
know. But you're right, starting them now to start having those conversations and getting comfortable
Yes.
with their provider and knowing how to tell them, because a lot of people come to us and they're like, okay, this is what's going on, I'll fix it. And it's like, but I need more information. They're like, but my leg hurts. And I'm like, yes, but what else? I need some more
Yes.
details, because then that tells me what I need to do. So if you start helping them to become more comfortable
Hmm.
discussing, this is what's going on, this is what happened, and this is what I did for it, blah blah blah, then it really can help us be able
Hmm.
to do what we need to do with them. And then the other thing is, and I'll be honest, as a parent, when it comes to certain things, sometimes we want to just do it. And
Right.
I would encourage parents to not do that and have that reflex, especially as your children get older, because like you said, let them to start looking, okay, if I know that I take my doll for this, how many am I supposed to take, instead of you just saying, okay, go and get two out the box, or here, just bring me the box and I give it to you. You start showing them, here, read the box, what does the label say? It says I'm supposed to take two, how often? So that way, that will get them in the habit of knowing, this is how I do this. So once they get to the stage of going to college, it's not like, oh my gosh, my mom's not here, she usually gives me,
Hmm.
but after that, I don't know what the next step is, right? So
Yes,
that's
and
really
the piggyback, yeah, and the piggyback off of that, if you are on medications chronically, now is going to be the time to know what's the dosage amount, what's the milligrams, how frequently are you taking them, knowing the actual name of the medication. Because when you come to see us, you're right, we're creating a picture, a full picture, and one of those components is going to be your medication list. What are you already taking to make sure that it's safe with whatever else we may be prescribing for them as well? And the second thing that I will say is practice makes better. No, we're not going for perfect, but
Mhm.
practice is going to make better. So the earlier you mentioned 2 years old, I'm with you as soon as you can start talking. That's why I love my teenagers because they're going to tell me most of the things once we can establish that relationship.
Right.
They're going to be off to the races and ready to go. I am all for it. Tell me all the things so I can know how to best help you. And the best way to do that is to start practicing.
Yes. Now, I like you said, the relationship, because building a relationship with your provider is very important. When should, especially our young ladies, when should they start establishing these relationships with their provider? And then, we have that transition, they're going off to college. Do I need to go and establish some with somebody when I'm off to college? Do I wait until I see someone when I come home? That sort of thing. And then what are we looking for in this age group? Are we looking for a family medicine doctor, an internal medicine doctor? Are we looking for OBGYN? Like, how do we help them figure out who to go see and how to navigate that?
Yes. So, how to transition beyond the pediatric realm,
Hmm.
right? So, it may be that you're going to a different location for college. Some people may be local, so it may be a little bit easier for them depending on what age level their pediatrician goes up to. But we know for many of our college kids or those that are graduated after high school, they may not, stick around, locally anymore. So we have to account for that. Whether it's helping them to start the search even before they go to know different options outside of, say, their student health center, if need be, in case there are certain medications that the student center may not be able to prescribe. That's something to consider and to think about. But then also, like you mentioned, the type of doctor, what specialty should they start to consider or work with? For our young ladies that are starting out, I would urge them to find someone that's age appropriate for them, meaning every gynecologist may not see those that are under 20 or someone that's 18 or a little bit younger than that. And you want to know that before you schedule an appointment and take time to go to a visit that may not be the age appropriate one for you. Similarly, with family medicine, we want to check, okay, is this an age group that you're comfortable with? And is this a condition that you're comfortable treating? And it's kind of building a reference list from there that can be helpful. Adolescent medicine is another subspecialty that exists where they focus solely on teenagers, young adults. Some go up to 21, some may go up to 26. With myself being trained in both family and adolescent medicine, I have the joy of going up to whatever age I choose to. And so, really understanding the practice and the physicians, the healthcare providers on that team that they can help you at that age point, that's going to be really important going through.
Okay, because I know that it's so funny that you mentioned this, because I'm thinking about some patients that I've had that were seen by pediatricians, and I was like, what happened? And it's like they kicked me out.
Yes, yes, they aged out. They got
They
too
aged
old for
out.
the pediatrician. Or now we're thinking about hormonal therapy options
Mhm.
that we may need. And the pediatrician's like, I'm sorry, that's not my wheelhouse. That's
Right.
a perfect time to find someone that can be helpful for you if you're needing that. Whereas you're preparing to transition, or even once you transition to your next location, you can have those puzzle pieces in place and ready to go for you.
That's a good point, because just like I know a lot of people research colleges and the area and all that kind of stuff, but you're right. People can start looking at and seeing,
Mhm.
what doctors are in the area and which person will make a good fit. Because if this is going to be the person that you're going to see while you're there, you should go ahead and start establishing with them. And I love for people to see me before they are sick. I said that's the best time to see me, because we can
Yes.
really establish a good relationship. When
Mhm.
you're sick, you don't feel well, you're like, get to the point. I'm sick, I don't feel well. What are you going to do to fix it? And then we can come back and talk about whatever you want to talk
All
about.
those later. That's right.
Right? So
Yes.
So that's why I'm like, go when you are well, because then you can
Mhm.
let them know these are the issues that I have. This is what typically happens. Right now, probably on cruise controller, everything seems okay, but blah, blah, blah. So then that way, this person has an idea of your history, what's going on, and what the next steps are. But in that same vein, the other thing I want to pivot a little bit and kind of talk about like HPV vaccines,
Mm,
because
mhm.
on that list, there's a checklist of all the things that you have to do for college. And one of them is they require that you would have certain vaccines. HPV is technically not one of the required ones, but on our end, from what we see, we're like, it really should be required because we know how well it can protect people, that sort of thing. So talk to us about that HPV vaccine. And even with this, your scholar may have gotten it before
Mhm.
they got to this age, because you can start getting as early as 9 years old. But if they have not gotten the vaccine, now is the time to really start thinking about it, because they can still get some protective benefits from it. So just talk to us about the importance of that vaccine.
Yes, and I love, love, love this question when it comes to HPV, the human papilloma virus, and talking about the vaccine that can help in preventing you from having HPV transmitted to you. Literally, the HPV vaccine is about cancer prevention. Yes, it can help with genital warts too. And if that's what we need to do to make sure we get it done, then yes, genital warts it is. But it's absolutely about preventing cancers. And the beautiful thing about it is that it can help prevent for not just your young lady, not just us as ladies, but
Mhm.
also for our guys, also for the men as well. Yes, cervical cancer, but also different oral, throat cancers, anal cancers. So, really, it's a wide range that this vaccination is helping to protect and keep people healthy and safe from these type of medical issues. And yes, you're right. In terms of when to start the vaccine, you can start as early as 9. Most people may get it around 11, 12-year old age when we're getting other required shots like tetanus and meningitis shots. We kind of put it there with it, but you can start as early as 9. And the beautiful thing, you can go up to 45 now. It's been approved up to age 45. So with your teen, your young adult being in say 18s to 20-year-old range, perfect time to still consider getting this vaccination. In terms of dosages, let's say they started before the age of 15. If they started before 15, they may have had a dose, maybe kind of fell off along the way. It wasn't a required one. Go ahead and get that second dose. You'll only need 2 doses, and then you'll be done. Two and done if you started, yep, before the age of 15. Now, if you started at 15 or after the age of 15, then you'll need 3 doses to complete the HPV series. But again, if you already started it, maybe just didn't finish it, this is one you can finish off. You don't have to restart the series all over again to still get that protection that you need. But I definitely try to remove the stigma that can
Mhm.
sometimes come with the HPV vaccine, because many may think, okay, this is only for people that are having sex. Nope, that is absolutely not the case. What we're trying to do is get this vaccine on board prior to any exposure to HPV, regardless of what age that may be. No, we're not encouraging sex. No, this does not encourage increased, promiscuity or increased sexual behaviors. Not at all. But your child is protected not just while they're young, but for a lifetime.
Excuse me.
No, you're
Okay.
okay.
I appreciate that. The other thing I want to ask you about, because we have protected them from cancer, we
Mhm.
have also talked about the ways to get them prepared if they need medicines, and how to have a nice little toolkit and medication kit and hygiene kit and all those things to get them there. But we also know that unfortunately suicide rates and that sort of thing can happen and increase in this age group. And it's one of those things that happens on college campuses. They may not talk about it, but
Hmm.
it happens. And I want to help protect our students and our scholars from that. And it's happening because you're very stressed. Again, college is a transition, and it's happening to the students that we feel are like super prepared. This is the
Right.
person who was valedictorian, and they had all the chords, and they had all the this and the that. And it's like, well, what happened? I don't understand.
Hmm.
College can be stressful. A lot of anxiety and depression starts to present itself in that way. And what I know is that a lot of students and a lot of parents are not sure how to navigate that and don't know what resources are available to them. I mean, I'll be honest, I didn't know that that was available to me when I was a student. I knew about the student health and to go if I had a cough or a cold, but I didn't know if I had just, and it's not even suicidal thoughts. It could just be like, I miss home. How do I navigate missing home, and how do I navigate I feel a little bit different. I used to be at the top of my class, and now feels like I'm struggling a little bit. Like, how do I deal with all of this and all of these emotions? And so I want to encourage you to look for those other resources. There are therapists and counselors and stuff like that. But from that perspective, because I know Dr. Duggan, she has done an extra fellowship in adolescent medicine, and she knows that there's a lot of different things that are happening in the body, physically, mentally, all of those things that's happening during this age. So how do we help them to be able to, like, discuss more about what those resources are and kind of what it can look like and when they should seek help?
Right. That's such a huge topic now. And a lot of talk goes around like COVID and how that's changed a lot of the socialization for the generations that have started to come after that. But really, with, like you said, with mental health, it can present rather in so many different ways. There's not one way, one look of what a mental health challenge is. Like you said, whether it's the valedictorian of the class, where there's someone you're like, they kind of flew under the radar. You just never really know. And so one of the things that I urge for our parents to do is to keep the door open. Keep the door open for these tough conversations. If you start to notice a change in your child, in your teen, meaning like it's not that they just withdrew from, say, an extracurricular activity so they could focus on their academics. No, they're starting to withdraw from everything. So whether it's, yes, it's the activities, but now they're more withdrawn from peers. Now they're more withdrawn from their studies where their grades are starting to change. It's almost a whole effect that's starting to happen. And even with you, they may be withdrawn from you more so than they typically would be as well. Some other signs could be more physical, that in the way that they present, what we call like somatic symptoms. So they may present with, I have this generalized or abdominal pain, this stomach pain, and they've had all these different workups for it, and no one can kind of figure out what it is or what's going on. Are they starting presenting with new like headaches and things, and we just don't really know why after that's been evaluated too? So it may be some other different type of physical signs that they're starting to show, that's not outright, oh, I'm anxious, or oh, I'm feeling depressed or down. It may present physically in a different way, and they may start to withdraw from a lot of different things over time, or it may be something quickly that's happening, but you're starting to notice that. And those may be some flags that, okay, something really isn't right, and we may need to move quicker. Then, like you said, the Student Health Center, we want to reach out to mental health resources, whether they're on campus, if they're needing another step up, whether, say, it's psychiatry, now we need to talk about medicine, something off campus. Then those are all options that could potentially be available as felt to be necessary, but kind of keeping that door open for sensitive conversations because they're starting to kind of raise those flags with you. Oh, what did you do this week? Not much. Just kind of been in my room. I really didn't feel like getting up and going to class today, so I just didn't. Okay. Is there something else that's going on? Are they open enough, or are they open enough with us to have that conversation, or do we need to find someone that they can be
Right.
open enough with to have those tough conversations to get them the help that they need?
And I know there's some parents that say, well, I FaceTime them and they seem like they're okay and blah, blah, blah. Because we do have at least that video interaction that I know
Mhm.
I didn't have at that age. That technology just wasn't there yet. We weren't there. But the other thing, though, I would still encourage parents that even if something feels off, because as a parent, you have this intuition, you're like, something's not
Just not
right.
really.
It's
Mhm.
just something's just not right. Trust that, lean into that, and you may have to, depending on how far away they are, you may have to pop up. You may
Mhm.
have to just go and lay eyes on your child because depending on how they FaceTime you, you could see a nice piece of what you're looking at. But then when you come in there, you may see the room is a tornado and you're like, this is not the kid that my
Mhm.
kids be really neat and had the things together. This doesn't look like I'm just busy with school. This looks like
Mhm.
I just can't pull it together.
Right.
So if you feel like you have to do that as a parent, I just felt the need to say that because I know that sometimes, you just like, well, where do I want to let them have the independence. I want to let them
Mhm.
do the things, but sometimes you still may have to kind of like step out a little bit and go and check on them and lay eyes on them, take them out to eat, have those conversations and figure
Yeah.
out what is it that we need to do to kind of help support you. So,
Absolutely. Yep.
yeah.
No, absolutely.
So I know that, and I'm going to talk about her health because I absolutely love what you guys do and what you stand for. But before we get into that, I just want to know, did you have any more tips or points that you want to discuss in regards to just helping these scholars really being completely ready as they transition to this next phase of their life?
Yes, I would say a helpful pointer would be that they don't want you to be perfect. You don't have to be perfect at any of this. Everyone is figuring this out as you go, but they do want you to be present. Even though
Mhm.
it seems like now we're independent, we're growing up, we're figuring it all out, they're still kind of looking to you a little bit for that little bit of extra support, that presence. If you can show up for a certain event or things that are important to them that you have going on, they still appreciate your presence. So it doesn't have to be perfect. You don't have to be perfect, but they still appreciate your presence.
Oh, nice. And listen, I know that you are making a wonderful presence in Athens, Georgia with her health because just what you guys stand for, healthy, empowered, ready. Like it says it in its name that you are really helping these young ladies and these young women to be able to transition and know more about themselves so that they can take themselves to the next level and be confident in who they are and what they're trying to do. So, talk a little bit more about what you guys do and who you serve.
Absolutely. And thank you so much again, Dr. Booth, for having me. This has been such a fun conversation. And you're right, this is what I do, and I love it like through and through. With her health, we help our teens and young adult ladies to confidently embrace their menstrual, their reproductive, and their sexual health so that they can live the life that they choose. So these are things that are often not talked about. These are things that are often overlooked. These are things that most people try to avoid, but they're so important when it comes to our just day to day and our livelihoods. Our periods, if they're normal, which for most people they will be, they're going to be with us for most of our lifetime. And really making that adjustment now from being home, we have pads readily stocked because mama or grandma, somebody got us on deck, to now this is my responsibility to make sure that I have what I need, whether it's from a physical standpoint with period health needs, to having something for my cough and colds that I may need, to making sure that my mental health is okay. Or if I want to start a hormonal therapy, if I want to switch from what I'm already on, where can I go? Who can I go to in case I'm not comfortable doing all of these things on campus? There may be some off campus options as well. And that's what Her Health is here to offer, an additional resource that's really close for people that are here near Athens and the surrounding counties. And yes, that is the concept that we bring, that open, comfortable area for safe and sensitive conversations.
What age groups do you serve?
Yes, so we start as young as 11 years old in terms of the age group at Her Health. And now we're going up through college age, actually through grad school age, and up for some age of 30. So we're helping our young ladies throughout that lifespan and that chunk of time when a lot of transition is happening from puberty to periods, and really starting to figure out this adult living as well.
Right. And then I love that you are creating a safe space. And so if people want to be able to join you, especially the young ladies from 11 to 30, and they're in the Athens or surrounding area, and they are like, yes, this is what I need, and I need a safe space to be able to do this, how can they join the practice?
Absolutely. Yes. Our contact information for Her Health, you can check out our website at www.herhealthga.com. And also, whatever social media platform floats your boat that you like the most, check us out there too, whether it's YouTube, IG, whether it's TikTok, at Loretta Duggan MD. That's where you'll find me. And also on Facebook, we're there as well at Dr. Loretta Duggan Her Health.
And guys, please check out her social media. She's giving wonderful tips. So if you are not in the Athens area, it doesn't mean that you can't get this great information. She just did a series on what to expect at your first, like when you go to the GYN and you're having that visit and they're looking at the things, and what should you expect and what should they do and what does it mean when they're talking about this versus that. So you can still get the information that you need. So feel free and please go ahead, subscribe, share, all the things so that you can stay in contact with her. Well, Dr. Duggan, thank you so much for your time and for your information, because I know that we're really going to set these scholars up for success along with their parents.
Absolutely. And that's what it's about. It's a team sport at the end of the day. So thank you so much for having me. It's been a real pleasure.
Thank you. Well, guys, thank you again for watching Lessons Beyond the Stethoscope. I am Dr. Ashlie Booth, and until next time, I'm wishing you much healing.